Hi, Dr. Roseann here, and today we're talking about, does my child have ADHD? I'm an integrative and pediatric mental health expert who's on a mission to change the way we view and treat children's mental health. If you're new to my channel, hit subscribe and turn on notifications so you get my videos every week. Let's dive in. We've all heard a lot about ADHD and ADD, but do you really understand what it is? We're going to talk about it because people often think just because you can't focus, it's always ADHD. People with ADHD, their brains work differently. They have too many unfocused brain waves and not enough focused brain waves. It's hard for them to pay attention, have impulse control, or what I like to call put the brakes on. Avoid distractions. Many times people misunderstand ADHD or they misdiagnose it. What does that mean? It means that we often think that people with attention difficulties always have the brain-based disorder of ADHD. Well, there's a lot of things that can interfere with our focus and attention. You could have anxiety and have a hard time paying attention. You could have obsessive compulsive thinking and have a hard time paying attention. You could be sleeping terribly and guess what? Have a hard time paying attention. We always need to look at what are the reasons, right? And so if problems with attention just creep up, we want to think about what else is going on in that child or teen's life. Could it be depression? Could it be anxiety? I often see those issues impacting attention just as much as somebody having ADHD, and that's surprising to parents. So we need to really peel back the layers and look at what's the source, when did it start? If somebody really has ADHD, those symptoms need to start before age 7. So let's talk about some of those symptoms. So we talked about difficulty focusing and concentration, distractibility, and impulse control. But kids and teens with ADHD can look very different. There's all different ways that ADHD shows up in a kid. Some kids are super fun and easygoing, but really distracted. Then there are kids that have ADHD that might be really impulsive. And, there are those kids that other kids might call obnoxious, which isn't true, but it means that they have a hard time putting their brakes on, and that kind of wears out friendships, right? So they're the kids when the teacher said, put the ball away, they don't, or goes too far at recess, or goes too far with a group of friends telling a joke, right? They just don't put that brake on quick enough. That can be really hard, right? If you're always being impulsive, or what I call the Homer Simpson effect, right? The doy, because he's always doing something he's not supposed to, but he just can't stop himself, right? But kids with ADHD who are impulsive, it's hard for them because they don't want to do what they're doing, but they can't seem to slow down enough. When people are highly emotional and they overreact, it's stressful for them and it's stressful for the people around them, right? And then there are lots of kids with ADHD who are so bright and they're able to fake it. What does that mean? These kind of kids can do pretty well until you put a lot of work or require a lot of organization from them. And then you start to see the cracks happen, right? They wrote a paper, but they can't find it. They never turned in an assignment because they never started it. You start to see inconsistencies in both their grades or what I like to call their output. And one of the things that's hardest for parents to understand about ADHD is that these kids can pay attention to what their brain is interested in. And paying attention to boring things is almost impossible for them. The way their brain works is it locks in or hyperfocuses on high interest areas, and it just wants to ignore and not do things in low interest areas. Where for people like us who may not have ADHD, when they're doing an activity that's boring, we have that ability to future think and say, well, I need to take this class to pass for licensing exams. But an ADHD brain says, that is so boring. Find something else that's interesting. When we start understanding what ADHD is, teaching kids about their superpowers and teaching them about their brain and how all the ways that they can learn to hack in and pay attention when it is boring. We've got to be really explicit with these kids and give them the tools. They also do well. Kids with ADHD also do really well with a lot of structure and predictability. So when we talk about ADHD, we got to talk about how do you diagnose your kid? So a lot of times kids with ADHD are diagnosed after a simple and short interview. Dr. Rowe, she's not a fan of that. What you need to do if you think your child has ADHD, you need to find a specialist who works with kids with ADHD, and you want to make sure there's no medical sources of their difficulties, like having nutrient deficiencies, which could affect your brain. I do something called a QEEG brain map, and it's a really great way to check under the hood and make sure your child does actually have ADHD, but also rule out other things like anxiety and depression. So you can find providers all over the United States at bcia.org. You really want to really get in there, make sense of it, but most importantly, go to somebody who specializes in ADHD. Pediatricians will do a simple behavioral checklist, and many times, again, you can have a lot of different sources that could be impacting your attention. We want to really be objective, and lab work and QEEGs are my two favorite ways to at least get started and have objective data. You want to have the right information so that you can have the right treatment at the right time in the right order. And that really is very helpful. And having lots of conversations with kids about things that they're good at and things that they maybe struggle with, and problem solving. What are tools and techniques is a great way for kids to better understand themselves and not feel so ashamed. Guess what? There are lots of things that we as parents and adults struggle with and might not be so good at, right? We didn't choose careers in areas that we stink at. We need to share those conversations and lighten it up, because when your kid has something that interferes with learning, behavior, it's just hard for them, and they're going to feel bad about themselves. By educating them and opening up the dialogue, they really can feel much better about themselves and secure. And certainly, if you are struggling with that emotional component, or you're struggling as a parent on how to help your child, you want to find a licensed provider. They can really give you that care and guidance. And we now know in the time of COVID that if you can't get to somebody in person, you can find an amazing teletherapist, somebody that can help you virtually. So there really aren't barriers to getting professional help and specialized help. So what's my Dr. Rowe know? It's thinking that medication is the only answer for ADHD. I'm here to tell you that there's a lot more evidence-based treatments for ADHD. And something that may be very surprising to you is that neurofeedback, which is a evidence-based, brain-based treatment for ADHD, is rated a level 1 treatment by the American Academy of Pediatrics, which is the certifying board of pediatricians. This level 1 certification by the American Academy of Pediatrics is the same level that Ritalin and psychostimulant medications receive. So it means that it's at least as effective as that. But I'm here to tell you that there are so many natural treatments that help support brain health. So what's my Dr. Rowe go? My Dr. Rowe go is using evidence-based approaches to ADHD treatment. We have so many things that help support brain health and help support the learning and behavior of children with ADHD. And psychotherapy and parent training are two types of therapy that have been used for decades to help support children and their families. What works with kids with ADHD is to pair regulating the nervous system through these techniques like neurofeedback and biofeedback with new learning through psychotherapy. When we get the brain to be more alert and focused, and we come in with teaching these kids different ways to control and regulate their behaviors, boy, the sky is the limit. Kids with ADHD are full of ideas and creativity, and we can't put these kids in a box, nor should they be. These kids are creative thinkers who, with the right kind of TLC and psychoeducation and support, really the sky's the limit for them. So remember, if you or a child you care about is struggling, it's going to be okay. I'm here to show you natural and effective ways how to help children and teens feel calm, alert, and good about themselves. I want to hear how you're supporting a child with ADHD. So drop it in the comments below. Catch you on the next episode and subscribe to the Dr. Roseann channel where we talk about natural and effective ways to reduce and reverse mental health.